In this video, we will be going to discuss two conditions with an association to the retina, namely Retinitis Pigmentosa and Retinal Detachment. But first, what is the retina? The retina is a layer of nervous tissue that covers the inside of the back two-thirds of the eyeball. This layer senses light and sends signals to the brain. This allows us to see. Retinitis pigmentosa is a group of rare genetic disorders that damage the light-sensitive rod and cone photoreceptors in the retina. The rods, which provide peripheral and night vision, are affected more than the cones, which provide color and clear central vision. People with retinitis pigmentosa lose their vision slowly over time. Usually though, they will not become totally blind. Retinitis pigmentosa results from harmful changes in any of more than 50 genes. These genes carry the instructions for making proteins that are needed in cells within the retina. The underlying mechanism involves the progressive loss of rod photoreceptor cells in the back of the eye. This is generally followed by a loss of cone photoreceptor cells. Signs of RP usually appear during childhood or adolescence. In the early stages of RP, rods are more severely affected than the cones. As the rods die, people experience night blindness and a progressive loss of the visual field. The loss of rods eventually leads to the breakdown and loss of cones. In the late stages of RP, as cones die, people tend to lose more of their visual field, developing tunnel vision. They may have difficulty performing essential tasks of daily living such as reading, driving, recognizing faces and objects, or walking without assistance. Moreover, due to the sight loss brought about by retinitis pigmentosa, patients may be classified to have low vision. How is retinitis pigmentosa diagnosed? Retinitis pigmentosa can be diagnosed and measured by comprehensive eye exams. Comprehensive eye exams by doctors of optometry are an important part of caring for our eyes, vision, and overall health. A test known as fundoscopy is done to show signs of pigment deposits known as bone spicules and pigment clumps in the retina. Electroretinography. This test measures the electrical activity in the retina, or how well the retina responds to light. People with retinitis pigmentosa have a decreased electrical activity, reflecting the declining function of photoreceptors. Genetic testing. In some cases, a clinician takes a DNA sample of the person to give a genetic diagnosis. And this way, it is seen if a person has certain genes that are associated with the disease. Currently, there is no cure for retinitis pigmentosa. However, research indicates that vitamin A and lutein may slow the disease's progression. However, there is a concern that high intake of these supplements may lead to the worsening of the other eye conditions. Ophthalmologists and optometrists can advise about the risks and benefits of vitamin A and how much can be safely taken. A number of services and devices are available to help people with low vision to carry out daily activities and maintain independence. Low vision aids including telescopic and magnifying lenses and other adaptive devices can help people with retinitis pigmentosa maximize their remaining vision. A doctor of optometry who is experienced in low vision rehabilitation can provide these devices. He or she can provide information about the other training and assistance to help people maximize their functional vision and independence.
Retinal detachment is one of the common causes of low vision. This image is a normal eye or healthy eye. What happens if there is a retinal detachment? So, What is retinal detachment? The retinal detachment, it is an eye problem that when your retina is pulled away from its normal position at the back of your eye. So if the retinal detachment untreated, there is a big chance that you can see permanent. But if you have a severe retinal detachment, you may not be able to see as clearly as normal, and you may notice the other sudden symptoms. First is the floaters. It is like squiggly lines that float across your vision. Next is photopsia. It is flashes of light in one eye or both eyes. And another is gradually reduced side vision or the peripheral. As what I've said earlier, if the retinal detachment untreated, it increased the risk of permanent vision loss or blindness. For your understanding, anyone can have a retinal detachment, but there are some people are at higher risk, and you are at higher risk if first, if a family member has had a retinal detachment before. Then second, you have a serious eye injury or trauma. For the example, you caught with someone and accidentally hits your eyes. There are three types of retinal detachment. First is the rhematogenous. It is the most common type of retinal detachment, and it can happen if you have a smaller tear or a break in your retina. And rhematogenous retinal detachment, most common cause is aging. Next is the fractional retinal detachment. It is typically seen in the people who have poorly controlled diabetes, and it happens if scar tissue on your retina pulls your retina away from the back of your eye. And what are those other causes of fractional retinal detachment? We have eye diseases, eye infection, and swelling in the eye or inflammation in the eye. And last, the exudative retinal detachment. It happens when the fluid builds up behind the retina, but there is no holes in the retina. And if there are so many fluids behind the retina, it can push the retina away from the back of the eye, and it will cause to detach. Exudative retinal detachment can be caused by age-related macular degeneration, injury to the eye, and inflammatory disorder. And for treatment, it depends on how much of your retina is detached and what type of retinal detachment you have. First, we have freeze treatment, also called a cryopexy or laser surgery. If there is a small hole or tear in the retina, the doctor can use a freezing probe or a medical laser to seal any tears or break in the retina. Next is surgery. If there is a larger part of the retina is detached from the back of the eye, we need a surgery to move the retina back into normal place. So the individuals with visual impairment, for example the retinal detachment, poor vision, and complete blindness, it appears to face the obstacle that can limit the physical education participation. And the truth is that when given equal opportunities and motivation, children with a variety of physical impairment have the ability to perform better than their same age peers. What is low vision therapy? Low vision is usually lifelong. Unfortunately, eyeglass, medication, and surgery usually can't cure low vision, but they can also improve your vision and help you to perform more efficiently everyday activities or keep your vision from getting worse. How low vision patient can take full advantages of the remaining vision. If vision loss is minor, they can be able to make small changes to help their self see better, and they can do the things like, first is use brighter light at home or at work, and second, wear anti-glare sunglasses, then lastly, use a magnifying lens for reading and other near activities. And if the vision loss is getting it, the way of everyday activities, ask your eye doctor about vision rehabilitation, because a specialist can help you to learn and how to live with your vision loss. And this can include things like, first, training on how to use a magnifying device for reading, then guidance for setting up your home so you can move around easily without the help of other members of the family.